My name is Dr. Tony Kimani, and I'm CEO of PreMedicus. So I grew up in Kenya and came to the United States for college and for medical school. I raised a family here, and it's a really exciting time to be at the intersection of business, medicine, and technology. I'm a pulmonary and critical care doctor, and I've practiced in academia and in private practice for about 25 years. I've made the leap to join the growing movement in digital health as CEO of PreMedicus, which is a precision population health company. I was not a very techie person. I've been a physician and wasn't really used to apps and software and those kind of things. But when I went to business school, because of an interest in wanting to contribute more with my medical background in the field of technology, we went to China as part of my Georgia Institute of Technology MBA program. And we visited one of the premier hospitals, and it's huge. They had maybe 1,000 people waiting to be seen in the emergency department, and sometimes the waits would take days. It really didn't cost much, the equivalent of $2, but the time that was wasted waiting to hear what's wrong with me and what should I do next was tremendously long. And meanwhile, patients who were on their smartphones, playing games, sending emails, texting, and it really seemed discordant that this powerful tool that they had in their hands couldn't help them with the dilemma that they were in. And that was the spark that created PreMedicus. So at PreMedicus, we're solving the problem of urgent and emergency care. There's so much waste in that area. People come to the emergency department or seek urgent care without necessarily knowing what's wrong. And 2/3 of them don't really need to be in the emergency department. That causes a lot of waste in the system because it costs 10 times more to be cared for in the ER. But how do you know that you need to be in an ER versus in your doctor's office? That's where we come in. PreMedicus is a digital medicine company, so our software actually thinks like a doctor. It helps you when you input your information, and knowing about you, we can help decide what's the best location of care for you, what might be going wrong, and even refer you to the in-network providers that will keep your out-of-pocket costs low. So our customers are large enterprises that are involved in population health management, health systems, large insurance companies, government health providers like the National Health Service in Britain. And what we want to provide for them is a way to understand what's going on with their population, intervene, lower costs, improve the user experience both for their patients and for their providers. The way that we do that is having a couple of mobile apps that interact with the different users. For example, a sick patient would use our mobile app to figure out what's wrong, where they should go. And when they show up in the ER, because that's the best place for them, that information, including their past medical histories, are already available to the ER doctor. And that discussion that takes place between the patient and the doctor gets digitized with the patient speaking in their own voice by voice recording what they're feeling and what's going on, and the doctor voice recording. And that whole interaction being put together in one document that the patient has access to at the end when it's signed by the doctor in real time, and having control of their own medical records, I think is quite revolutionary.